was about to go to that report. We can go back on the sound. Sorry, yeah, we did go on a slight break. We could hear you talking, but you couldn't hear us responding to you. So do apologise for that. So we're going to move. Did you see my thumbs up? Good.
We did.
Good. Did you see anything else? No? Okay, so we're going to go on to the integrated performance report, which is performance, quality, workforce and finance. And Simon Worthington, the chair of, let me get this right, Finance, Performance and Contracting Committee is with us, just in terms of some of the assurances of stuff that's gone through that committee. So it's lovely to see you, Simon, and thank you again for agreeing to chair that committee for us. So we're going to take it in the usual kind of way. So we're going to look at this twice today. Once in the public session, where I think we can get the overview, and then in our private session later on, I think that's the opportunity to kind of have a much more detailed kind of conversation in terms of our current kind of position. So you have the paper in front of you, which is our movement towards, our really positive movement, I think, towards triangulated dashboards that are putting things all together in the right kind of places. And I think there's an opportunity here just to round out in terms of the conversation around performance, the money, the workforce stuff, which I think alignment of the workforce stuff, I think was something the board were particularly asking for last time. But then also kind of looking it through that quality lens. So I think there's still a work in progress, I think, Amanda, around how we integrate the quality bit kind of fully moving forward. So we're going to talk about this, and then we're going to talk about winter separately, aren't we, Sean? Because I'm keen that we don't mash winter up with everything else, because that's a particular thing.
Yeah, absolutely.
So am I handing to you first?
Initially, and then I'll bring in Desmond and Jamie who talk about the new within our means elements that relate particularly to
It's the headline stuff, isn't it?
Finance. So just by way of context, this is the usual performance report each month for the board, and this deals with the majority of the data, month 5. For UEC is month 6, and in the case of mental health and one or two other areas, that's slightly earlier in the year, just because of the time lags in relation to those aspects of data. In headline terms, we continue to receive some challenges around urgent emergency care, particularly in relation to our 4-hour standard and 12 hours in department. There's some particular challenges at one or two of our providers, although largely we are maintaining a reasonable position on our Cat 2 response times in terms of ambulances, so that remains an area of continued positivity given the progress that we've made in the last 12 months. In relation to plan care, we've got some variation around the referral to treatment 18-week target and also around 52-week waits. But in terms of our overall waiting list, apart from the aforementioned and previous sort of reference, York and Scarborough increase in relation to their overall waiting list that's down largely to their EPR system and capturing process. Our total wait list without that would be below plan, and that's an encouraging position to begin. We have still, however, got a rump of 65-week waiters that we have a target to get to 0 by the end of December that is looking increasingly challenging in relation to getting to 0. Cancer diagnostics, as we've talked about previously, and we had the deep dive on cancer at a previous meeting, and we've got diagnostic deep dive coming in December, as you already mentioned, Chair. Remain areas of constant focus for us and challenge, and we've still got some way to go there in terms of our position against plan. Although some colleagues may have seen the BBC headline earlier this week that suggests that only 3 of the 121 acute providers are actually hitting the acute cancer standards around 62 days, FDS, and 31 days to be seen. So you can see there that that's not unique in terms of the challenges for Yorkshire. In headline terms around primary care and dental, we can report that we're on plan in that area, and they both remain positive areas of progress. And likewise, in terms of hypertension and CVD, that's recovering from some seasonal dips that we've experienced. And again, pleased to say that from a mental health point of view, there is some positive progress around our position in relation to the targets that are on plan in terms of trajectory so far. In terms of workforce, I'll ask James to say a bit more, but the agency spend is 21% down compared to this time last year, although our whole-time equivalent numbers are over plan. And as Des will come on to, we've got some challenges around our financial position. So let me just bring Jay and Des in.
Okay, if you just pause to see if there are any questions around performance. So some green shoots, some positions that are not and are causing us particular concern as a system, but also in terms of individual providers. And in terms of the cancer piece, after our deep dive, I have had a very proactive kind of conversation with the acute chairs around the data we have received around cancer that was shared, and shared that with them in terms of asking the question around how agitated is your board around the cancer position for your organisation, that kind of thing. It's a really good way of just testing out the data, but also highlighting that really key kind of area of concern. And actually, in lots of ways, for me, and I think this board, really focusing, being interested in what other people are doing around cancer, but actually my real focus is about saying, for patients in our patch, across our 6 places, and in our acutes, are we comfortable with our position around cancer? Are we comfortable with our position around diagnostics? And if not, what are we doing about it? So sharp at the right time.
Yeah, and I've had some follow-up from that from a number of senior executives of organisations who have taken more interest on the back of their chairs, taking more interest on the back of you sharing that with them.
Sorry, not sorry. Anya.
Hi, thank you, Sean. We've spoken about it before, so I don't expect we can answer it now, but I think it would just be really helpful at a point to be able to understand the cohorts sitting behind these numbers, and I think some of it links to the conversation we've just had about Get Britain Working, because undoubtedly, some of these long waiters, that will be impacting on their economic activity, for want of a better term. But I think that would just be really helpful, because you can't help but feel that some cohorts will be disproportionately affected in these numbers. And it would be remiss of me, I know we all know this, but not to pull out, when we think about some of these figures, so 146 people waiting well over a year for elective treatment, that's like 3 times the capacity of this room. It's still a huge amount of people, and I just think we can't lose sight of these are people, and these are lives that are being affected.
And the people that I think is really important, and actually in some ways, if it was 1 person or 2 people, I would still be really concerned about it.
Absolutely.
I think it's that whole bit that's saying, what's our tolerance for performance? Who was going to go next? There wasn't. Go on then.
So I just want to pick up on the UEC performance. Obviously, because we are in November, we're heading into winter, and we have made progress over the summer. And I just want to recap really some of our prioritisation around our UEC activity. Obviously, there is a lot of work and a lot of improvement work and a lot of focus around all aspects of our UEC activity, including out-of-hospital care and trying to meet needs in the community to avoid people arriving in our hospitals, and at the other end, actually, ensuring timely discharge. There is a lot of work, and I don't want to play that out. What I do just want to remind everybody, with Sean's statement around our underperformance around particularly the 4-hour target, we looked at this and set our stall out around the prioritisation of improvement work around making the biggest impact on patient safety. So we targeted first the ambulance handover times, because the biggest risk to patient safety was the patient waiting for an ambulance in the community. So we targeted that first, and then built on the reducing the 12-hour wait times, because that is waits over 5 hours associated with increased morbidity and mortality. And if you like, the final thing to crack is then the 4-hour. We've not lost sight of that, despite slight deterioration in performance around the 12 hours. So I just wanted to reinforce that as key messaging really around our approach to UEC.
Okay, anybody else with a performance question? Are we going to people next or money? Do you want people? People?
Yeah.
Des was very firm there that money was going to come first. People going.
People always come first, yes, definitely. So a couple of things to just set the scene, and then an update on the triangulation work, which I think was of real interest to the board last time, which we'll pick up in a bit more detail in part 2 of our agenda as well. So in terms of whole time equivalent against plan, that's 0.6% over plan, but the money, the cost of that workforce therefore is a higher, the spend is 1.7% over plan. That's the month 6 position, by the way. So we've done the Pay Bill and Agency Management Committee have done the triangulation work, so the output of that triangulation work, and just to remind people, that was looking at so what is driving that spend in each of our separate providers, and it is quite difficult because the workforce plan uses one piece of technology and the finance plan uses the ledgers, so you're comparing in a very difficult way. But there were some key drivers that came out of that. One of the biggest things, I think, the key action point out of all the work that we've done around that was to improve the underlying plan and then the actuals triangulation for each of our providers. And there is one provider, Michelle, yours, you already do this, where you do the work matching ESR against the ledgers. It's quite complex work to get up and running and to make sure that you're doing it, but you do that regularly, and that's why your figures are... Yeah.
The bosses that were have everything, so that if it's not on ledger, it don't exist.
Yeah. So the HRDs have already had discussions around this to look at other organisations doing the same, and I mean the feedback from your organisation, Michelle, is it's worth the time and effort to do that because it gives you more real figures against the whole time equivalents and of course your ledger. Until that work is done though, and complex though it may be, we're still going to have this triangulation issue because we're comparing apples with pears to some extent as we work through it. So I think that's the biggest update. The other thing to say is that our spend on temporary workforce is 27% over plan. That's on all temporary workforce. Quite a lot of that is bank spend because there's been quite a lot of conversion into bank. The good news is though that our agency spend compared to this time last year, and we did a lot of work last year as well on reducing agency spend, if you remember, is 27% reduced compared to the same period last year. And overall, we're 25% against a target of 30%, bearing in mind we were given that target to achieve. So I think that's probably all I would say so far on.
Super. Michelle?
Yeah, I'll just mention it here because I mentioned it everywhere else in the chat. So I've got this real issue with bank being classed as a negative variable in relationship to workforce. I think if it's a trust organised bank, then on terms and conditions, contracts, policies, procedures, quality driven, everything else. And I think in order to maintain quality, flexibility with staff, a lot of staff organisations like ours use bank in the right way. So it's not just seen as a reduction in agency. I mean, it's helped us wipe out a lot of our agency expenditure. But I think absolutely an inappropriate, I know it's not the ICB's problem, but please quote me on this because I've mentioned it to everybody that moves. And it's an inappropriate measure of how an organisation monitors its workforce. I'm really sorry because you want a flexible workforce, you don't want to over-recruit, which is actually what it's pushing trust into doing, which again then affects your bottom line and your balanced position. Because if you can't use bank and you can't use agency, but you've got some flexibilities about acuity, or you're trying to do something that's a bit different from a transformation point of view, you rely on your bank.
Jane?
Sorry, I feel better for that.
No, and I think that's a really fundamentally important point around what bank is and what bank isn't.
I don't actually disagree with you, Michelle, and I also think that the cost of bank is so much lower than the cost of some of our other workforce spend, and that doesn't necessarily come through when you're just looking at the percentages. There was one last thing I was going to say, which is compared to month 5, we've had a decreased growth, if that makes sense. So an improving picture in month 6 compared to month 5.
So some positives, I think within both that performance bit and the workforce bit. So I think we do need to, despite the fact we are, I think, concerned about performance in some areas, we need to know the real positivities around healthy qualities, primary care, and also kind of mental health, and actually that improving kind of position in terms of workforce. And I kind of think getting to the point where we're actually having a triangulation conversation around the workforce piece is incredibly positive. Because actually this has been a real driver to say, how do we join all this stuff up? And I think the fact it's happening, it's maybe not giving us the outcome and the answers we want, but the fact that we're able to do it and share across HR and finance, is really positive, and including it, integrating into this report as well. So Des, the time has come, we can't avoid it any longer. Money.
Thank you, Chair, yes.
And Simon, I'm going to come to you once Des has printed the money, just for any reflections on behalf of the committee as well, if that is okay with you. So, Des.
Thank you. So the data that we're looking at in the pack for the purposes of today is the month 6 reported position. For the ICB, we continue to post break-even position as of month 6, but what sits underneath that data is a quite significant overspend on our independent sector, both in the acute and mental health space, offset by underspends and savings in other areas such as community and prescribing. So whilst it appears to be a balanced position, we've got a few areas where we're having to factor in recovery plans and take a detailed look at specific actions to address those overspends to manage our forecast to the end of the year. In terms of our providers, we have a posted deficit of £24 million as at month 6 versus a planned deficit of £20 million. So we're £4 million off plan. That was £1.3 million deterioration from the month before. The drivers for that, I think in part, as Jane described, some of those workforce overspends, but also we're picking up pressures around sickness, and industrial action. The most significant variance though is on the delivery of the efficiency plans, which collectively is £13.9 million behind plan as at just in the provider space. And so that is where we are focusing efforts through SOAG, and also have had external review on the balance and the risk for the balance of the year, and we're just expecting some responses from our providers on the recovery plans that they'll be putting in place to address that. So in terms of our forecast position, at the moment that is still a break-even position, in part because we're not able to move away from a break-even forecast until the protocols change, and we've been notified that won't happen until month 10. So it is a break-even position, but at the mid-year reviews that Jason mentioned earlier, we have had commitment from our providers that they are still working towards achieving a break-even position, but signalling significant risks, especially around the efficiency delivery space, as well as ongoing staff pressures. So we're working through that. As I said, we've got formal recovery plans from all of the provider boards, but those still show a degree of unmitigated risk in them, and that's also reported as one of the segments on our report. That figure as a collective system is still 77 million, so it's unchanged from month 5. 17 million pounds within the ICB, which relates to the independent sector and our reorganisation assumptions, and the balance 60 million sitting within our providers. So that is the challenge at the moment of what we need to address between now and the end of the year. And obviously, as the year progresses and as we're not seeing a movement in that unmitigated risk, so we continue the conversation around what that looks like in terms of quarter 4 deficit support funding, and also what additional support actions between ourselves and the region have to be brought in to clear those risks. The final bits of the report, so capital as at month 6 as a system, we were £14 million behind plan, but we've got some really robust actions to clear that, and we continue to move capital between our providers as we can mop up the capacity. So there's still a degree of confidence at this point that we will be able to close those gaps, and the region has asked, National has asked us to make some really firm commitments against that. So there's some new plans going through, which we're just working through at the moment, but our providers remain good. They will achieve that by the end of the year. And then finally, our cash as a system remains slightly above plan, despite the size of the deficit. So we'll continue to monitor that, but no one's signaling at this point any significant cash issues.
So my reading of that is there is significant finance pressure, and that pressure gets worse as we get towards the end of the year. Am I right in reading that?
Yep.
You see, I have been listening to you, Simon. Simon, anything you would want to kind of pitch in terms of Finance Performance Committee kind of perspective in terms of the money?
Sure, that's fine. I think Des has covered all these sort of numbers, if you like. I just would encourage the board to your point, Jason, about the pressure getting to the end of the year. That's not because spend's increasing, that's because the plans are very backloaded. So particularly in the providers, a lot of the savings are supposed to happen in the back end of the year. And Des has commented on the external assurance that we've received following a request by the committee to get that. I think that underlined the risk within some of the providers and them being able to deliver their plans. So there's positive work that's happening, but the board, I think, should not be surprised if, as we move on through the months, that some of the providers start to go off plan, and there is a material risk, which I think Des has reflected, that they won't all deliver. Yeah.
Brilliant. And we can pick up on some of this in more detail, I think, in part two as well. But very much in terms of, it feels as though, through, I think, the work of the committee, I think Simon, and the work that's happening across, the workforce and the kind of delivery and finance kind of communities, I think we have an understanding of the problem, and actually now we need to move to that bit that says actually practically what can we do in terms of what feels like, and we're going to talk in 1 minute, Sean, about winter, aren't we? So this is all in the context of where we are now, and then of course we have the joy of winter, or the gift of winter as it was described to me. So I'll come to you in a moment in your capacity as winter director, Sean. Teresa.
Yeah, sorry. I'm sorry to do this, but I just want to make sure that the board, and most people around the table, will actually understand this. But I think we just need to note it. And that is, so let's draw those threads together. We've got a significant financial challenge as of month 6. That's against a position of predominantly driven by failure to deliver CIPs, of which the delivery of CIPs is backloaded, as Simon says, to the end of the year. So that risk gets greater the further into the year we go. I think we need to be cognizant of the fact that where we are at risk of not receiving the deficit support funding. It's that bit I want to make sure everybody understands. With our current level of financial performance, it is unlikely that we will get the deficit support funding, which makes our financial position even worse. And I think we just need to recognise that. And we've still got the unmitigated risks. So effectively we've got risks there, financial risks for which we have no plans. I think that's the in a provider space.
Loss of deficit support funding is not incorporated in that.
Absolutely.
Yeah.
So we just bandy the figures around. That's the reality of what we're facing in the coming months.
Yeah. Unless we do something about it. Stuart.
So we have the old position of not being able to restate our forecast till month 10, I think you said there's again.
That's what our expectation is at the moment.
Well, I guess I'd like to be assured that our head office understands where we're at, even if we can't formally change our forecast.
Yeah, so that's what they're mitigated risk reports, that comes from what we're reporting up.
Because I wouldn't want it to come as a surprise.
No, I think we've been very, very, very clear in those conversations. I mean, we can come back to this in part 2, I think, in a little bit more detail, but I think it is about the board understanding that, particularly that current finance risk, the increased risk that may present as we move forward, and sitting that alongside performance and sitting that alongside the workforce kind of piece as well. And there is some quality stuff within the report as well, which I'm conscious that neither Michelle or Paul are here. So we can pick up on the quality stuff. I think the integration of the quality stuff in our conversation next time is going to be really important, because I think it tells the story by the quality stuff being in there as well. Okay, so we're going to pick this up in part 2. We're going to move Director of Winter, putting that hat on now, Sean. Actually, it's a big fur one.
You do remind me more of this one than any others. It's absolutely clear. Yeah.
I'm jealous because I'd quite like this title.
Yeah, indeed. And I reciprocate by calling you a piece of furniture, so it's fine. Yeah. So I think just to briefly remind colleagues, notwithstanding what we've just heard around the triangulation of performance, quality, and finance, obviously winter also brings with it multiple joys and pressures every year. And this year there was, by way of reminder for board, a real commitment to try and plan earlier, and that was undertaken. And Roland may recall that we submitted a winter assurance checklist plan at the end of September, alongside every provider in the country to do likewise. And so we went through a process of doing that. And so what I want to just give a very brief update on where we are against that position and some of the challenges we've been experiencing the last few weeks, and also to finish with a collective plea to everyone, if that's okay. So following that assurance at the end of September, we submitted and we identified a number of actions. We're going to come back to this in part to more detail around where we've got to in some of those in more detail, Chair. But essentially, we received then some follow-up requests from Managers England in relation to that, as did other activities around primary care capacity in the light of the changes from October, and also around our arrangements with discharge processes and interface with local authorities, which we duly responded to. We've seen, coinciding with the start of winter and winter management reporting from the October the 27th, some challenges during October and November, I think it's fair to say, and we've had a number of our providers that have spent more time on Opal 4, that's the highest level of escalation that you can be at during the course of the last week. In fact, today is a similar situation where we've got a number of our sites at Opal 4, and the reasons for that are multiple, really: demand, IPC issues, infection prevention control, and the challenges around flow and other factors that have been very much prominent during that space. We've coincidentally also received in the last couple of days some further requests from Managers England about our arrangements over the Christmas and New Year period in terms of access to primary care and primary care out of hours, and also around our arrangements for out of hospital access in terms of urgent treatment centres and other areas. So you can see that there's anxiety across the country around the position, and as was the case last year, access over the 5-day bank holiday during Christmas and New Year becomes more problematic. The other thing that colleagues may be aware of is there's been some signalling in relation to the likelihood of flu hitting earlier than predicted, and therefore at the back end of November and early December, coinciding with the conclusion of the industrial action with Julia Doctors, which is scheduled to start this Friday and finish next Wednesday. A sense of all providers have been asked to look at their plans again, to look at their robustness around bringing anything forward if in the event that hits, and the challenges around that. So again, we're working through locally around making sure that there are robust arrangements in place. I think what I would just conclude the update for the board chair by saying is clearly linked to flu and the anticipated earlier pressures there is vaccination becomes even more important, and certainly across a number of client groups there's been some really good progress, and in terms of the 4 ICBs in North Eastern Yorkshire against all the client groups in terms of children, vulnerable groups, 65 plus, and staff, we are ahead of other ICBs in this particular region in terms of where we are at this moment in time. And in terms of staff vaccination, we've got Harrogate at 51% of its staff as of last week in the top 5 of the providers nationally. So that's really encouraging, and Michelle, your organisation's at 49%, not far behind. But I think it's important to re-emphasise the fact that we have got some other providers that are not at 49% to 51%, and they need to be. And also in terms of social care and other providers, we need to absolutely reinforce the importance of that. So if we take one message away from this board today, I think we need to go back and make sure that we're optimising our capacity to vaccinate our staff and encourage you to take up, given the challenges that we've got now and the likely to be over the next few years.
That is a significant risk, and we're having a winter conversation where it feels very mild outside, and I've still got roses growing in my garden. It feels very strange time I'm moving. So I'm gonna ask Teresa around the resident doctors action, and I'm gonna go to Bushra, because in the midst of all this, in the midst of all this stuff around performance and the stuff around planning for winter, we have a period of strike action.
Yes.
And I guess the board publicly needs an assurance around arrangements during that period of industrial action, which is starting this Friday.
Yes, and it's very nice of you to come to me, but I'm going to pass it to Sean to
But I wanted to give you the opportunity to then pass it to Sean, because it's like that hospital.
Yeah, so I think myself and others want a meeting this morning. We've got a further meeting at lunchtime today with Managers England. All providers have now submitted their plans and their assurances around where we're at. The expectation nationally for Managers England is that we keep 95% of our elective activity running as best we can, which is quite optimistic in terms of the expectation, although clearly the fact that this spans a weekend, you'd see a drop down in terms of level of activity in any event. but clearly Mondays are always a pressure point, and it's likely to be the case during industrial action. Paradoxically, you do get better discharge and earlier senior decision making as a consequence of that. So we're obviously positives around some of that aspects, and clearly we don't know at this moment in time the full extent of the strike and how many jury doctors are going to participate. But as things currently stand, subject to conversations on time, we've got a relatively high level of assurance around plans and arrangements, Chair, for the provider.
And that's a constant review, isn't it? Through the entire.
That's despite the fact that the national guidance for this didn't come out until 6 o'clock last Friday.
And was very instructive. I thought very instructive.
So there's just two things to say. One is obviously the impact on our workforce of those who are having to do additional cover, not only in the hospitals but actually our staff for on call, etc. And the intensity of all of that activity, I think should be noted. And the other, of course, is that it could have a negative impact on the financial situation as well, which is not yet factored into any forecasts.
Yeah. Okay. So anything anybody wants to pitch in part one around where we are in terms of winter? So we have a plan. We know what we need to do. Oh, sorry, Bushra. It's because you start. I wondered if you were just contemplating, and then I saw the finger go.
Yeah. I think it's very lucky that we started looking at it early, because even though it's mild, we're seeing it already, aren't we?
Yeah.
And the hospitals are seeing it. We are seeing flu. We are seeing a lot of respiratory illness. There's a bit of concern in general practice, but as I gather it, we have no plans to actually stand up any extra capacity in primary care in terms of winter access funding. So in previous years we have had access to additional funds that has meant that primary care has been able to stand up extra capacity to take some pressure off practices in terms of seeing those unwell children, the respiratory illnesses, the things that really are quick see and do. At the moment, those appointments are taking up time and space in general practice, which prevents us then being able to see the other more complicated things, the people who might have other more significant illnesses, which means that they may be delayed and then end up at hospital being much more unwell than they would have done if they'd been seen 5 days earlier in general practice. Is that likely to be the continuing position? Are we going to be putting winter access into secondary care but not into primary care?
Yeah, I mean, obviously you raise an important point. I think clearly in looking at our plans for winter, we took a number of things into account, one of which was the revised arrangements around the lessons for primary care and the additional capacity that we put in there, which wasn't the case last year. So obviously balancing off what you described there last year vis-a-vis the additional resources that's gone into that. And clearly, as we've already heard, the challenges around the financial action were a material consideration in that. So in the round, you're absolutely right, there's no additionality in the same way, but what we would suggest is that there's, built into the core less contract, there is additionality over and above last year. Now, you may or may not think that that's necessarily the case, and clearly the demand that you see is causing the challenges that you just described. But clearly, you balance a number of these things off, we did take that into account.
Okay. Anya. Sorry, Teresa,
Sorry, I just wanted to say that there's not been any additional funding for secondary care in the way that there has been in previous years. There has been no additional funding for UEC winter monies in the way that we might have been familiar with in previous years.
Mental health as well.
So that's why it was really important that we had the conversations about the less work that's been happening across primary care to try and refocus some of that.
Okay. Anya, final word on winter.
Can I share a bit of good news about winter, please, Chair?
Is this to do with Christmas?
No, it isn't.
Right.
It's insane boo to the flu. So I just wanted to share with the board that we managed to get a small amount of funding to support targeted winter communications campaign activity. And as part of that, did a pilot during half term in the North Point Shopping Centre in Bramsholm that some colleagues will be familiar with. And this was data driven because that's one of the areas with the lowest uptake of vaccine, and particularly childhood vaccine. We took over a disused shop unit, branded it, really super engaging, and with the help of and support of Vaccination UK staff, We engaged over 1,100 people in winter wellness conversations, 350 people received winter wellness packs, 150 children learned about the importance of hand hygiene through a really engaging hand washing activity as part of our germ lab that we've developed, and crucially 84 children were supported to have their vaccine over the period, 60% of which were walk-ins, and I said they wouldn't have got it through other mechanisms, and we've got some really helpful insight as well as to why children aren't getting their vaccinations in the school environment, and over 40 other eligible people were directed to the pharmacy for their flu vaccination, and so much was the success that we've now had colleagues from across the Humber and North Yorkshire patch, particularly through our public health colleagues, asking if we can deliver similar activities in some of our other patches. So I just wanted to share that.
I think that's outstanding. I think that's exactly, thinking around how do we tackle some of this stuff differently. That's a really good example of how a really simple approach gets really massive kind of outcomes.
Really low cost as well.
Super. Michelle?
Yeah, well, I think I mentioned it last time that we're a pilot organisation for health visitors to do measles vaccination, so we've actually just started that now on behalf of England at the moment to see how that goes, and that'll be in the home, so we'll keep you posted.
That's really good. I think anything that is about an opportunity to talk about vaccinations and actually, kind of really challenging some of the myths people have around them is incredibly positive, because chances are if one person gets vaccinated, the power of word of mouth means that other people will, and that turns it into a really positive experience. And I think Sean, you've emphasised the need to really think about vaccinations at this point in time, not only in terms of workforce but in terms of communities as well. Okay, superb. So we're going to move on from winter. We're going to now talk about sustainability.
We're going to do a quick introduction.
I'm going to do a quick introduction.
Very
I'm
quick.
conscious.
Yep.
I'm conscious of time, but
Yep.
it's a very nice slim paper,
Yes.
and there's a set of actions that we just we're being asked to contemplate as a board.
Indeed. I was just going to do a very brief overview of why the report is here, and then I'll hand over to Nolan just to give you some specifics. So,
And Nolan's on the screen, by the way.
It
Hello,
is on the
Nolan.
screen.
Nice to see you again.
so the board approved our sustainability plan at the beginning of the year, and just as a point of good practice, we're bringing it here mid-year review to just do an update on that plan. What we're not talking about today is the actual reporting in our annual report on the plan, which we're picking up to the audit committee, and you'll see on the audit committee insights report that we're picking that specific reporting on that. So I just wanted to make sure it was clear it's a separate thing from our statutory reporting. This is an update of where we've got to and addresses in part some of the actions that were brought up when we did approve the plan, just in terms of the partnership working. We've included some partnership information on the report as well. So just with that, I'll hand over to Nolan, and he can just pull out the key highlights.
Okay, Nolan, there's a challenge for you.
Okay, and I'll do that in record time, bearing in mind that the time scale is mentioned. Okay. So as is already mentioned, in July of this year, the ICB approved its Green Plan, together with 3 key actions, which were oversight through the ICB's governance framework, HMY performance being regularly monitored, and climate issues routinely being considered in decisions. The report is the first of a biannual series of reports which address all of these points, and that is supported by detailed quarterly reviews by the ICB's audit committee, again as Des has already mentioned. The Green Plan sets out an ambitious framework for the ICB to meet its statutory duties, which is essentially an 80% in greenhouse gas emissions by 2030 and achieving net zero by 2040, centred around 3 aims of net zero, climate change adaptation, and improved health and well-being through the natural environment. To achieve this, we've got 12 areas of focus which are set out in the report, underpinned by 49 actions and 37 performance measures which cover the 3-year period of the Green Plan. Today, progress against those actions and aims has been good, and further work is ongoing to support the development of a programme-based approach to further progress, which is being supported by the ICB's governance team, which has been incredibly helpful. Significant in that is that we'll need to confirm specific leads for each of the 12 areas of focus across the ICB, and further details of that will be brought forward in further reports, cognizant of the imminent blueprint-related changes that will be happening across our ICB. And then in addition to that, we have been strengthening governance, strategy, risk management and approach to use of metrics. This includes arrangements to ensure that climate-related impacts are considered fully in all decisions at every level taken by the ICB. And a key part of this is ensuring that climate-related issues are properly considered within the use of our integrated impact assessment tool. And it forms a key part of ensuring that ICB compliance with the mandated task force on climate-related financial disclosures, which is an important part of our annual reporting, again, as Des has already mentioned. So in conclusion, progress is good. Further action will require contributions from colleagues across the ICB and the wider system, and our future approach will balance both ICB-specific performance and wider system leadership approach. And the recommendations are as set out within the report, which concludes my summary, and I'll take any questions.
Beautifully done, Nolan. Beautifully done. So, any questions for Nolan? Of course, Green Plan is the thing that looked like it was going, but now it's staying. All right, thinking?
Yes, so that's our latest understanding. So in the model ICB, it was one of the things that we wouldn't be having any responsibility for in the future, but the latest position is, like a lot of things, it will be staying with the ICB.
Staying with the ICB. And actually considerable progress since we signed that off. I kind of think huge amount of work done in there, and hugely impressive to see that range of work in the report as well in terms of our providers, in terms of what people are doing around this agenda. Are there any questions for Nolan on this, or are people happy to support the recommendations and receive a further update? So I'm taking it means in 6 months' time. Biannual means 6 months' time, doesn't it?
That does, yeah.
So we're talking May.
Yes.
It's taken me 10 minutes to work that out, but let's try something. Okay, thank you, Nolan, for that as well. I mean, I think, and also the assurance here that actually the report and stuff is kind of going by our audit committee as well, who are mindful of the statutory duty of the ICB to do this. But thank you for all the work you're doing on this kind of agenda. And actually, in some ways, I kind of think it makes sense for this to stay with us as an ICB, because actually I think this is about our commitment across the partnership towards sustainability. So I think we've got a really strong plan. I think the board endorsed it, and some real progress and some really, really strong action. So thank you for everything you're doing with this, Nolan.
Thank you.
Thank you. Superb. So moving towards the final furlong. So insights report. So you've got a hefty pack of insight reports there in terms of our committees. Not proposing to go through any of them in particular detail. I think there are some real assurances in there in terms of the work of what the committees are doing, some of which is kind of already linked in to the work of this board. If you look at some of the things around risks, I think there are some common themes and trends which you would anticipate at this point, which are around the uncertainty around the future, uncertainty as to where things and responsibilities will sit in the new world kind of ICB, some concern around, you know, what the organisation might look like in the governance, and also significantly, and I think this is where we started this morning in a conversation around the impact of uncertainty on staff within the ICB and the ability to continue to do some of the things that are being highlighted in this report. So they're there for kind of information. It's the connectivity between the board and its committees, and there is an assurance that the risks that are being identified are being carried through within the individual risk reports, linking back to the presentation on the risk register we had a couple of meetings ago. Mark.
One thing very briefly, just to say that that particular quality committee, we did have a presentation from the deaf community, and I know we haven't been able to do that today, but Sarah Riggin came, which was very useful. And I think one of the main insights for us was not to assume that people who are deaf can read proficiently.
Yes.
And particularly to think about whether, in terms of our thinking about ED&I, you know, I think we sometimes overlook things like that, and we really shouldn't. So I'll just shut up at that point.
Yeah. That's a really good trailblaze for December's meeting, and I think we need to give some thought. I think I don't want to receive that video in private, so I think we may need to look at how we might have some public time in December in order to kind of do some of that stuff, because actually in some ways we would have seen this had we had technology working. So I think we probably need to be quite flexible in how we do that moving forward. Any other questions around the insight reports? They seem to be working now in a rhythm, so I'm pleased with that. Item information, you've all got a link through to the ICB Good News briefings that are going out, and to say there is, despite what we touched on today, there is some real good news for us to share as an ICB and across our wider partnership. In terms of closing remarks, I just want to say, I mean, we've had a meeting that I think has joined together loads of other threads in a really kind of smart way in terms of the ICB's legacy stuff or the ICB's role kind of moving forward. Some really honest kind of conversations around where we are now in terms of our position, in terms of performance, money, workforce quality, but also, kind of real sense of that we're now in a position to move forward towards what the new world will kind of look like. We'll pick up more of those things in part two of the meeting. The next meeting, technically our next public meeting is in January, but I've just said that we need to maybe look at a portion of December's meeting being public as well. But our official full public meeting is the 14th of January. I hate myself for saying this, but I'm going to say this. So to anybody who has joined us today, I hope you have a lovely Christmas, and I hope you have a very, very happy New Year, if I don't see you again. And at this point, I'm going to resolve to exclude people from the remainder of the meeting so we can move into our private session. And to thank everyone for their time and for bearing with us through some challenging times in terms of technology. But hopefully you at least managed to kind of capture some of what we've said. We will be sharing the recording. We're now going to put Mark in a darkened room with ice packs on his wrists, having held that for the entire meeting. And the lights are now going out, so that's brilliant. But thank you very much, and I think the participation of the public and the chance to hear us doing our business, I think is very important to us as an ICB. So thank you for your time this morning, and I look forward to seeing people in the new year. Thank you.
Thank you.